Hi, my name is Jamie and I'm going to be your nurse today. Can I have your name and date of birth, please? I'm just going to confirm that against your wristband, and that matches. Alrighty, Tobias, so today I am going to change the dressing on your central line. Have you ever had that done before? No? Okay, well, we do this every 7 days to prevent infection, and it might be a little uncomfortable. I'll try to reduce the discomfort as much as possible. It also might be a little sticky, but after I remove the Tegaderm, I'll make sure to clean all of the stickiness off. Yes, I will clean the stickiness off, and then I'll put on a new one. And before I put on the new one, I'll make sure to assess the site of insertion and make sure there's no signs of infection. Do you have any questions about this procedure? No? Okay, good. And before we get started, are you in any pain? No, that's good. And do you have any allergies? Anything at all? Let's see, during this procedure, I'll be using chlorhexidine. I'll also be using tape. You're not allergic to either of those? Okay, good. Alrighty, so I'm gonna go ahead and get started. I'm going to perform hand hygiene once more. And I'm gonna put on a pair of clean gloves. I'm gonna clean this table with sandy wipes. I just wanna have a clean area to put my supplies on. So here we go, I got my clean gloves on. Clean this table. Alright, so the table is all clean. I'll just get the perimeter too, just in case. Alright, well, I dropped my sandy wipe, but no worries, I'll get another one. Okay. Clean around the perimeter. There we go. Okay, so everything's all clean. I'm just going to go ahead and drop that. And I'm going to wait 2 minutes for everything to completely dry on the table. While I'm waiting, I'm going to remove my gloves. And I'm going to perform hand hygiene once more. Okay, it's been 2 minutes. Now I'm going to get my supplies. I've got a box of clean gloves, so I'll place them right here. I'm going to put my supplies on the table. I've got a pen. This is for when I label your dressing. I'll put that right there. I've got a bio patch. This is a protective disc that goes under your Tegaderm dressing. It has antiseptic in it to prevent infection. I've got a pair of sterile gloves. I'll just put this to the side. It's an extra pair. And I've got my dressing kit. I'm going to go ahead and open this. Okay, I'm going to be very careful to pick up the sterile glove and place it right here. Alrighty, so I think I'm all set. One more thing, I'm going to drop this bio patch right into this box. There we go. Okay, so let's see. I'm going to have you turn your head to the side, away from the site of insertion. Thank you. Yeah, we just want to prevent any chances of you breathing on it, or, we want to reduce the risk of infection. Okay, so I'm going to perform hand hygiene. And I'm going to put on another pair of clean gloves. And before I do anything, I'm just going to confirm that the measurement of the tubing matches the measurement that was previously documented, and it does. That's good. It means that the tubing has not been pulled or displaced. Okay, so that is good. Alrighty, and you're not in any pain once again, right? Okay, good. So I'm going to go ahead and start removing the Tegaderm. Just let me know during this process if you're feeling any pain or discomfort. I'm going to start from the perimeter, and I'll work my way inwards. And when I get towards the center, I'm going to use one of my hands to secure the tubing, because I don't want to pull any of the tubing away as I remove the tegaderm. I'll let you know when I get to that part. Still taking away from the perimeter right now. Okay, I'm getting closer to the inside, so now I'm going to go ahead and secure the tubing as I remove the tegaderm. I'm also going to remove the biopatch with that. And are you feeling any pain? No? Okay, that's good. Alrighty, so I've got the dressing off. Good. Go ahead and drop that into the trash. And I also got the tape off too, so that's good. Got everything off in one go. I'm just going to take off my gloves too while I do this. Tegaderm is sticking to them. I don't need these gloves anymore. Before I remove my gloves, I'm going to take a look at the site of insertion. It looks like there are no signs of redness, swelling, or drainage, so that's good. And the tubing does not have any cracks. And are you in any pain? No? Okay, good. So I'm going to remove my gloves. And now I'm going to perform hand hygiene once more. And now I'm going to put on my sterile gloves. Okay, so I'm going to make sure when I put on this first glove, only going to be touching the inside part. Okay, I got that one on. I'm going to grab my other glove. Okay, now I can go ahead and adjust it because sterile on sterile, that is fine. Okay, and now I'm going to grab this. Really carefully just let that drop and I'll deal with that later. Okay, now we are ready to clean the site. I'm going to take this chlorhexidine brush. This has antiseptic on it. I'm going to clean the 2-inch border around the site of insertion very carefully. Okay, I'm done with that, and now I'm going to clean upwards on the tubing. I'm cleaning upwards because if there's any bacteria, I don't want to draw that inward towards the insertion site. So that's why we're going upwards. How are you feeling? Good? Okay, so we're done with that. I made sure to clean for 30 whole seconds. Now I'm going to wait 30 seconds for it to completely dry. I'm going to drop my brush into the trash. Okay, it's been 30 seconds. I'm going to go ahead and grab my biopatch. I'm going to grab it from the top because I don't want to contaminate it. Okay, here we go. I don't want to touch the bottom part. I'm just going to place that with the slit facing upward. Okay, I've got the biopatch on. Now I'm going to grab the tegaderm. Okay. There we go. So my left hand is soiled because I'm grabbing the cap. So I'm going to go ahead and use my right hand, which is sterile, to hold the dressing part. There we go. And I'll just flick that away. I'll take care of that later. Okay, now we are ready. Here we go. And let's see. And just once more, it's always good to confirm that the tubing measurement hasn't been displaced throughout this whole process. And yes, the measurement of the tubing matches what was previously documented. That's good. It means that nothing has been dislodged. So I'm going to go ahead and proceed and place your tegaderm on. Okay, there we go. Now that that's covered, I can let go of the cap and I can start from the center. How are you feeling? Are you feeling any pain? I'm going to start from the center and work outward so that I can minimize any air bubbles or wrinkles. Alrighty, so the sterile part of the procedure is over. I'm just going to peel this off. We got the bio patch on to minimize infection. We got the tegaderm on that also minimizes infection. Okay, so I'm going to put some tape on, and I just want to put the tape on to secure the tubing. We don't want it flopping around. So here we go, right there. Now it's secure. Now I'm going to write my initials. I'm going to write the date and the time that I changed your dressing, because it's very important that we change this every 7 days. And I'm going to put this on. There we go. How are you feeling? You feeling okay? Yeah, we're all done now. Okay, good. Once more, I'm going to go ahead and confirm. Yes, the measurement of the tubing matches what was previously documented. So that's good. Nothing has been dislodged. It hasn't moved or been pulled. Okay, so if you don't have any questions, do you have any questions? No? Okay, good. So I'm going to go ahead and throw my supplies in the trash. And I'm going to, okay, I don't need this. Throw everything in the trash. Everything in the trash. Okay. Well, maybe I'll keep the pen. But yeah, so I'm going to go ahead and remove these gloves. Do hand hygiene once more. And I'm going to start documenting. I'm going to document central line care, measurement and assessment. I'm going to document the date and time. And I'm going to document how you tolerated the procedure. Alrighty, thank you, Tobias. I'll see you later. I'll check in on you later, okay? Alrighty, thank you.